A very happy good morning to all of you. This is Manish, and today we are going to solve a question of social justice. Okay, it is comes under the syllabus of GS-III. Okay, so before solving the question, just take a read of this question. What question says that in crucial domain like the public healthcare system, the Indian state should play a vital role to contain the adverse impact of marketization of the system. Okay, and then suggest some measures through which the state can enhance the reach of the public healthcare system at grassroots level. So there are some keywords like public healthcare system, then Indian state, of course, the adverse impact of marketization means private healthcare system, and some measures some measures to reach. Okay, these are the keywords. Just put your attention on this, uh, and to the grassroots level. Okay, so before starting to solve this question, just I want to just to take some a brief of standard structure of solving men's question in UPSC. Okay, what is um, um, the what is the standard course structure? This is uh, like you introduction, then body part, and the last is conclusion. Okay, this question contains 250 words answer. Okay, so you can divide like 50 words in intro, 150 in body, then 50 in conclusion, then 50, or maybe the another way to write 50 in intro, 170 in body, and 30 in conclusion. Then another way you can write 30 words in intro, 190 words in body, and 30 words in conclusion. Okay, and there are some students who have got good answer and ranked in under top 20, top 100, sorry, top 10. Generally they start writing here are some measures, and start writing the bullets points direct the conclusion. Definitely the I think Roman Seni and Kanis Kataria, they wrote like this and got good mark. So you can write also, write like this also. Okay, so I think now I should start the question. Are you ready? You can start introduction in three way. Okay, uh, the first one historical approach, the second one is current affairs linked approach, and the third one is definitional. There are many ways you can start writing intro, but I'm just telling you my perspective. Okay, so in historical approach, how you are going to start. Like in historical approach, you start in COVID-19. We have seen health care system crisis, and then you can quote like national health and family survey 5, the doctor per patient bed per 1000 people. Okay, and you can write like this. Then in current affair linked approach, you can start with like if you are writing in March 2025, as of now I am writing, so you can write like recently, or in budget. So you can write like recently, or healthcare expenditure. expenditure is 1.97% increased, as Minister of Health and Family Welfare said in Parliament. Okay, so you can start like this. And then another one is definitional approach. Definitely, that's my favorite. This is define the public health care system. How you are going to define it? Just since it is public health care, so it should be government funded. Then it should be affordable to poor, marginalized. Okay, then it should be easily accessible. So these are the you can write the definition based on the basis of this 3 point. Okay, now come to the body part. The body part, there are two ways to write. Just start measure. Here are some following measures, or write down some adverse impact of marketization of public healthcare system. So you can either start from this, or write some few points of about the adverse impact. Then after that start writing the measures. Okay, so actually I'm when you are in uh, exam center, uh, so you have a pressure, and you have to write a time limit, so word limit. So uh, what I am teaching right now, that cannot be compared with of that situation. So actually in m- my thought just to provide you uh, good content, and the wholesome content that you can write. And you just don't need to write all the thing whatever I'm going to teach you, because the content is going to be more than 500 words. But you have to just put the bullet points and figure it out what you should write. That's what the perspective of every student different. Okay, so here I'm going to just provide you the content. So start with the adverse impact of marketization. What could be the impact of marketization on healthcare system? The first is rising fees. Definitely you have seen. I think you all people are old enough that you can see the significant change. Okay, significant change in fees of healthcare. Means if you are in 2029, if the doctor fees is 100, in 2024 25 the same doctor fees is 500. If 2029 a sugar test was 100, then in 2025 it is 500. If just take an example of I think a tablet, sugar tablet, or blood pressure tablet, your medicine. If it in 2029 it is like 8 rupees per tablet. Now in 2025 it is I think 15 rupee per tablet, or 18 rupee per tablet. So the rise of cost due to the marketization on the public healthcare system. The first point is rising of cost. Okay, now the second point, why rising in cost? That point leads to the commercialization commercialization of medical profession. How you have witnessed that many says, even many doctors, many activities says that nowadays doctor put some unnecessary tests. If you go to the health checkup, okay, health checkups, normal health checkup, you will see the list of tests like blood test, yeah, it's necessary, urine test, okay, then ECG test, okay. These are the example which makes the this profession commercialized, okay. Even they get their right, even they write some type of some people complained that a doctor wrote some prescribed some medicine which you can find only few shop or at the campus or clinic or hospital. What is that? Okay, they write certain company based medicine, or they refer to a shop which uh, which of their nearest one, not the nearest, nearest means in relation. So they got kickback from that. So this is also a way of a commercialization of medical profession. And this second point leads to the third point. Because of this commercialization rising of cost, it becomes inaccessible to the poor, means inequality to the excess. And inequality, there are two ways to inequality. First is rural urban divide, rural versus urban, based on because of the infrastructure and income. Definitely the income is also in rural area, if the income is like 5,000, and in urban area income is 5,000, take just 5,000 per month, and this is the what goes in informal economy. And the second one, definitely the poor versus the rich. This type of costly hospital only rich can access, but poor, in lack of money, or you may call it resources, they cannot access, okay. And why these all things happen, okay, the adverse impact, or all these three impact, uh, just because there are this, why leads to the fourth point, because you get sick. Why sick? If you know that you are going to sick, then prevent it. So that this leads to the preventive healthcare system, okay. Lack of focus. Most of the hospital what whatever does call under comes under the curative healthcare, means they curate curate after you get sick, okay. But prevention comes before you get sick. How could it happen? There are many ways. The nutrition, regular health checkup, regular health checkup. Okay, and so but because of uh, private hospital, the preventive, you have seen many of them, many of the doctor also, English doctor especially, uh, speaks loudly that home care remedy is not good for health. Home care remedy are not good for health. So they are also part of this propaganda. There should not be preventive, because preventive care cost, if preventive care cost is 100 per month, then curative cost is approx 1000 per month. This is the difference. Okay, and again, then all these four adverse impact, then why we are dependent, why we go to the private hospital? That's the that's the point. Okay, because we have dependence on private healthcare. Yeah, why? uh, because of latest technology, machinery. You have seen, listen, you have seen, or maybe read in newspaper or listen by someone that robotic surgery cost more, done by mostly in private hospital, than qualified doctor, qualified or highly skilled doctor. Or because of quality infrastructure, because they do R&D, because private hospital have enough resources. So we have dependency on private hospital. And actually, if you take an example of Delhi, I think there are 12 to 15 mm, large or big government hospital, and rest is private. Okay, so if you take example Delhi, this is the scenario. Just imagine about Bihar and Uttar Pradesh. What could be, or any the distant state or distant district or place, what could be the adverse scenario of those places? So, and this is the report that 80%, sorry, sorry 80% dominance of private healthcare system in Indian market. This is the dominant, and why? You have seen the scenario. However, you can link the question. However, there are some positive or advantage of private healthcare system, and you can write down some point from here. Because private uh, healthcare system and latest machinery, qualified doctor, quality, and R&D. You can write down. Now, when you will write all this up, now come to the second part of body, that is measures. What could be the measures? Definitely, first measure will be, now it is in also in news, right to health. You can quote that Rajasthan Health uh, Healthcare Act 2023 made right to health or health as a part of fundamental right in Rajasthan. Okay, So in similar way, like right to education, then added in uh, fundamental rights, so it become universal access to, it's become the universal access, it become the government or state duty, obliged, okay, it, now uh, state's duty to provide education, education to all. If they are not able to do, then you can proceed to the court, b- violation of, because of your fundamental rights violated. So these are the protection. So government should make a right to health as a part of fundamental rights. Okay. Now the second measure is, definitely it's a reach. Just remember, reach grassroots level. Okay. So how can you reach to the grassroots level? This is what the question asks. So this is the second point. It will be definitely the primary healthcare system. Primary healthcare system. Uh, uh, okay, primary healthcare system. We should strengthen primary healthcare system. Okay, you can just put an example of Thailand. Okay, there are 30 baht scheme where you need to pay only 30 baht, that's currency, per visit. Okay, and if you convert the 30 baht, Thai baht, to the Indian rupees, it's approx 80 rupees per visit. That's a cheaper. Okay. uh, so we can also amend some law, sorry, we can also s- some regulation or the schemes like this. And this primary healthcare system leads to the third point, that's a community health care worker, which are the they are the first to respond. Okay, who are they? ANM and ASA worker, and some, in some case, the Anganwadi worker, Anganwadi worker. So what we can do? Just guidance, uh, guidance training, and provide some, incentives, motivation to work more or in the right way. And they can be used as the awareness to the grassroots level. I think in a village there could be 10 to 12 ASA workers. So you can imagine that if they are regulated, they work proper manner, then our healthcare system will improve most. Okay, the and this second point leads to the third point, that is definitely decentralization. Decentralization. In decentralization, what actually we all have studied in polity, decentralized in two part, in village and city. Panchayati Raj institution. Okay, so in village, I think Mukhia and Sarpanch, and in city, ward, mayor. So we can give the authority or maybe administration administration to Panchayati Raj institution, like we can give, or state center can give to fund to the Panchayati Raj institution, and we can give them freedom freedom to use Ayurveda, whatever they find it successful, or English medicine, or homeopathy, or any type of. So this type we can do also. The next one is, I think we have covered one, uh, two, three, four. I think we got 4 point. 4 point. Now we are going to the fifth point. Okay, definitely, you if you want to reach to up to last mile, then we need a digital access. For example, 1 mg of data and telemedicine. So we can add and the mobile consultation. How it works? Okay, mobile consultation. Many of you have encountered the auto walas just speaking. Uh, you know, uh, Hospital name I just forgot, in Karolwag. Maybe just remind me. I think Gangaram Hospital. Sorry, the Gangaram Hospital. Gangaram. So there is a website. I just don't forgot. I just don't remember the name. If you go to that website, you will see the Gangaram hospitals, like 10 years of in surgery available for counseling at 1,000 per consultation, or whatever the per 15 minute or 20-minute cost. So this is also it can be accessible to the last mile, or to any length or breadth of the India, or in any part of the world. If there is a digital infrastructure, there is access of mobile network or internet. Okay, so this can we can also add this digital infrastructure. Definitely, now come to the expenditure part. So the first, definitely, sorry, the sixth point is, increase the percentage of GDP to healthcare. Healthcare expenditure. Now it is approx 2% of Indian GDP, and I think we should increase in 12% or 7%. Uh, and making your point, strong. Just put the quotation of, just put the data of Norway. They are just providing 12, I think, approx 12% of GDP, and they have global health index, the rank of global ranking first. So, but India doing this, and India is ranking 60. So don't worry, we are going to provide you the data. Then next is, on 7 point, we can, what we can do, we can uh, insurance coverage. Okay, we can increase the insurance coverage. Just make your point is strong. Just put the example of Germany. Definitely they providing 100% of its insurance, Germany. And Because of that, the rank is, I think, fifth or sixth in global rank index. uh, and 11% of GDP their expenditure, and India's expenditure is this. We are going to provide you that data, and now you can put like the 7 point, the 8 point age. I think it will be, you know, uh, preventive healthcare expenditure. Preventive healthcare expenditure. Just link your measures to the problems. That also a good way to write preventive health care expenditure. So in this section we should increase funding, definitely. uh, you can write, give the example of Japan. They have a strong preventive healthcare system, and their rank is, I think, comes on fifth. I just forgot the rank. We are going to give you the data. And what the India's rank, their life expectancy of Japan is, I think, 84, yeah, 85 years. Or India, and India's life expectancy is 70 years. Okay. Now we can add the ninth point, that is incentives. How you can use incentives? We can give incentive to the mechanical student. How, like fee waiver if you work in rural area. Or we can organize like some intensive, or with the help of NGO we can also do, uh, organize a camp. Then we can give the incentive to doctors, certain percentage of tax relaxation. We can give incentive to the private hospital on certain percent of tax relaxation. Like if there are 100%, out of it, if 20%, if they provide access to healthcare on minimal amount, so we are going so government will give certain percent of tax relaxation. Okay. And the last point, I think, the 10th point is public private partnership. How it work? Like just take an example of government hospital and private medical college. If the private medical college will come to the government hospital as a practice, then this will also increase, you know, the uh, the number of doctors to the government hospital, and which will lead to the strong healthcare system. Okay. So you can give an example of Kasturba Medical College of Mangalore. They are doing like same. And in the last, all I think we have done the 10 point is enough. And in last, in conclusion, you can write like uh, a private hospital, a private healthcare system is also also necessary for the development of India or our country. But we need regulation, strict norms to work with. Okay. And you can put your conclusion according to your perspective. Okay. Thank you. That's all.